It is 2:17 in the morning. Your dog climbs onto the bed, yawns inches from your face, and a sour, rotten smell makes you turn away. Then you hear a tiny click as he works his jaw, licks his lips, and swallows. At breakfast, one piece of kibble falls from the right side of his mouth. You tell yourself he is still eating, so it cannot hurt that much. 2 weeks later, there is a firm swelling beneath his eye, and a dental x-ray at the clinic reveals infection around the root of an upper tooth, hidden where you could not see it. The frightening part is that dogs can keep eating while their mouths hurt, and dental disease often advances quietly below the gum line. What if the warning that could have changed this story was not a dramatic cry, but a 30-second habit most owners never perform? Hi everyone, I'm Dr. Ryan Scott, your neighborhood veterinarian. Dental disease is common, uncomfortable, and costly because its first clues are often dismissed as dog breath or aging. Today I will show you the biology, a calm home check, the dangerous shortcut, safe tiers of home care, and when veterinary care is non-negotiable. If evidence-based guidance helps you protect your dog without panic, subscribe. Let's move into Chapter 1, the biology. Soon after a tooth is cleaned, proteins from saliva form a thin conditioning layer called the acquired pellicle. Oral bacteria attach to it and organize into plaque, a sticky living biofilm rather than a loose pile of food. Think of plaque as a microscopic apartment building. Bacteria adhere to the tooth and one another, while a surrounding matrix helps the community stay in place. A toothbrush can physically disrupt this soft film on surfaces it reaches. If plaque remains, minerals in saliva can harden part of it into calculus, also called tartar. That yellow, tan, or brown crust is not simply yesterday's meal, and brushing cannot safely lift off established calculus. Calculus provides a rough surface that holds more plaque, but plaque bacteria and your dog's inflammatory response are central drivers of periodontal injury. At first, inflammation may be limited to the gingiva, the gum hugging the tooth. Its edge becomes red, swollen, and more likely to bleed. Gingivitis can often be reversed when plaque is effectively controlled and any needed professional cleaning is completed. If inflammation extends deeper, however, the attachment between gum and tooth can break down. Periodontal pockets deepen, the ligament supporting the tooth is damaged, and supporting alveolar bone is lost. That is periodontitis. Daily brushing helps prevent plaque accumulation. It cannot regrow attachment or bone already destroyed by disease. Picture an iceberg. The crown is the small part above the water, while the roots, supporting bone, and much of the important disease lie below the surface. Bad breath may come from bacterial compounds in a diseased mouth, but smell cannot reveal the stage. Heavy tartar does not tell you exactly how much bone has been lost, and a clean-looking crown does not prove its root is healthy. A complete periodontal assessment requires an anesthetized, tooth-by-tooth examination, with probing and dental radiographs. Your home check has a different job, noticing change early enough to request that assessment before pain, infection, or tooth loss becomes obvious. Chapter 2 is the 30-second habit. Choose a time when your dog is awake, relaxed, and not guarding food or a toy. Do not wake him abruptly, pin him down, or force his mouth open. Spend the first 5 seconds watching. Is there new drool, repeated lip licking, jaw chattering, pawing at the face, or reluctance when you touch one cheek? Think back to the last meal. Did he drop food, chew mainly on one side, approach the bowl and hesitate, or suddenly prefer softer food? A dog who finishes dinner can still have dental pain, so appetite is one clue, not a clearance certificate. For the next 5 seconds, notice the breath while your dog pants or licks his lips. You are not expecting mint. You are looking for a new, persistent, distinctly foul or rotten odor, especially with redness, bleeding, or changed behavior. Then, spend about 10 seconds on each side. Rest one hand gently on the cheek, and lift the upper lip without tipping the head backward. Follow the outer tooth surfaces and gum line from front to back as far as your dog comfortably allows. Compare left with right. Normal gums may be pink, darkly pigmented, or mixed, so look for change. A red swollen margin, spontaneous bleeding, recession, a tooth that appears longer than its partner, yellow-brown deposits, a crack, a missing piece, discharge, an ulcer, or a new lump. Finish with a quick look at the front teeth if your dog remains comfortable, then stop. Do not pry the jaws apart, wiggle a suspicious tooth, press a swelling, or poke the gum line. Here is the safety rule. If your dog stiffens, repeatedly turns away, growls, cries, snaps, or seems painful, stop the check and call your veterinarian rather than using restraint. A painful dog is communicating, not misbehaving, and even a gentle dog may bite when a sore mouth is handled. One myth needs correcting here. White teeth do not equal a disease-free mouth. Your quick look can suggest a problem, but it cannot measure periodontal pockets or show what is happening inside a tooth or around a root. Plaque, calculus, staining, fractures, and periodontal disease require different decisions. Use the check to record what changed and where, not to diagnose it. New redness, persistent odor, tartar at an inflamed gumline, or a behavior change warrants an examination even if your dog still plays and eats. Now Chapter 3. The dangerous common mistake. When an owner sees a thick tartar shelf, the instinct may be to buy a metal scaler, reach for a sharp household tool, or book cosmetic scraping while the dog is awake. It feels logical because the brown material disappears. But the visible crust is not the whole disease. An awake dog cannot safely remain perfectly still while every tooth surface is examined. Pockets are measured, material beneath the gum line is removed, and dental x-rays are taken. Scraping only the crown can leave inflammation below the gum untouched. Scaling must also be followed by proper polishing, because microscopic roughness encourages plaque to attach again. The danger is mechanical and diagnostic. One sudden head movement against a sharp scaler can cut the gum, tongue, or other soft tissue. Blind work at the gum margin can injure tissue without treating the pocket beneath it. Worse, a white crown creates false reassurance, while hidden bone loss, a dead tooth, or a root infection continues. The real worst case is preventable progression to chronic pain, an abscess, severe loss of tooth support, and extraction of a tooth that might have been treatable earlier. The rule is clear: never place a sharp dental instrument in an awake dog's mouth, and never treat anesthesia-free tooth scraping as a substitute for a veterinary dental procedure. Chapter 4 is the safe alternative. Instead of trying to repair what you cannot see, monitor the surfaces your dog calmly allows you to see. Keep the jaw closed and relaxed, roll the flexible lip upward, and inspect the cheek-facing surfaces. Repeat the same sequence in similar lighting: behavior, breath, left gum line, right gum line, front. If you find a concern, take one clear phone photograph without shining flash directly into your dog's eyes. Note the date and side, and share it if your veterinary team accepts photographs. A picture documents change. It cannot replace examination or radiographs. Most importantly, do not begin vigorous brushing over an area that is bleeding, ulcerated, loose, swollen, or painful. That mouth needs assessment first. Chapter 5 builds home care in tiers. Tier 1 is for a comfortable dog who does not yet accept mouth handling. For 7 to 14 days, practice once or twice daily in sessions lasting about 10 seconds. Touch the cheek, lift the lip for 1 second, release, and immediately reward with praise, or a tiny piece of the dog's regular food. Over several sessions, extend the lip lift and briefly touch a clean finger to the outer gum line. Stop before your dog pulls away. Short, predictable practice pairs the sensation with reward. Do not hold the muzzle shut or chase your dog with a toothbrush. Force can teach fear and make future oral care unsafe. Tier 2 is daily brushing for a dog with a comfortable mouth and veterinary approval to start. Use a soft bristled, flat-headed toothbrush sized for your dog and toothpaste labeled specifically for dogs. Put a small pea-sized smear on the bristles and let your dog taste it. Lift the lip with the mouth closed. Aim the bristles at about a 45-degree angle toward the gum line and use gentle circles on the outer surfaces. Begin with about 10 seconds per side, then build toward roughly 30 to 60 seconds total once daily. The cheek-facing surfaces are the practical priority, because you can reach them without forcing the jaw open. Daily frequency matters because plaque reforms continuously. 2 safety rules belong with brushing. Never use human toothpaste, baking soda, hydrogen peroxide, essential oils, or a homemade acidic mixture in your dog's mouth. These are not formulated for routine swallowing by dogs, and some human products may contain unsafe ingredients. Never brush a loose or fractured tooth, a bleeding ulcer, a facial swelling, or a mouth that reacts painfully. Brushing is prevention and maintenance, not treatment for painful disease. Dog toothpaste does not dissolve thick calculus, so if a hard deposit remains after gentle brushing, do not scrub harder. Arrange an examination. Tier 3 is for a dog who cannot yet tolerate a brush, or, as an addition, chosen with your veterinarian. Select a dental diet, chew, water additive, wipe, gel, spray, or toothpaste carrying the Veterinary Oral Health Council seal for plaque control, tartar control, or both. The seal means the product met defined standards for that claim. It does not mean the product diagnoses disease or replaces professional care. Because formulations differ, use precisely the label-directed amount and frequency. For an edible chew, select the package size for your dog's weight. Give it only as often as the label directs. Include its calories in the daily food allowance, and supervise. Stop if your dog gulps large pieces, vomits, develops diarrhea, or struggles to swallow. If any water additive makes your dog drink less, discontinue it immediately and offer plain fresh water. Hydration matters more than an additive. If hard tartar, recurring gum inflammation, or persistent bad breath remains despite home care, the answer is not a stronger chemical. Your veterinarian may recommend pre-anesthetic testing based on your dog's age and health, anesthesia with airway protection and monitoring, full-mouth dental radiographs, probing, cleaning above and below the gum line, polishing, and treatment of diseased teeth. Antibiotics do not replace removal of a periodontal source, and leftover pain medicine is not a safe experiment. Give medication only when prescribed for this dog and this problem. Chapter 6 is my favorite advanced trick, and it takes 2 seconds in the pet store aisle, the thumbnail test. Press your thumbnail firmly into a chew toy. If you cannot make even a slight indentation, the object is too hard for your dog's teeth. A large chewing tooth may fracture when it meets something that refuses to yield. Skip antlers, hooves, bones, rocks, and extremely hard toys. Choose an item large enough that your dog cannot swallow it. Look for some flexibility, supervise chewing, and discard it when pieces loosen or edges become sharp. The safety rule is simple. A product marketed for dogs is not automatically tooth-safe, and no claimed dental benefit is worth a fractured tooth or swallowed fragment. Now Chapter 7. When home care stops and the vet visit is mandatory. Stop brushing, wiping, chews, and further home inspection, and seek urgent veterinary care for swelling of the face or beneath an eye, pus, or active oral bleeding. A tooth broken deeply enough to show a pink, red, or dark center, sudden inability to close the mouth, jaw trauma, continuous heavy drooling with distress, repeated gagging or difficulty swallowing, refusal of food and water, marked lethargy with oral swelling, or any breathing difficulty. These signs may indicate a root abscess, exposed living pulp, a foreign object, significant injury, or infection that cannot be safely managed at home. Breathing difficulty, uncontrolled bleeding, collapse, or major facial trauma requires an emergency clinic immediately. Even without an emergency, arrange a prompt appointment for persistent foul breath, red or bleeding gums, a loose tooth, visible recession, a new oral lump, blood on toys, one-sided chewing, dropped food, repeated pawing at the mouth, or tartar touching an inflamed gum line. Do not wait for your dog to stop eating. Only a veterinary team can safely inspect the entire mouth, probe below the gum line, obtain intraoral radiographs, provide anesthesia and pain control, clean and polish all relevant surfaces, biopsy a mass, or treat a damaged tooth. A normal 30-second check does not cancel routine veterinary oral examinations because important disease can remain hidden. Let's bring the masterclass together. The 30-second habit is not a miniature dental procedure. It is an early warning system. Watch behavior, notice a persistent change in odor, lift each lip without forcing the jaw, compare both sides, and record anything new. Soft plaque on a comfortable mouth can be disrupted with daily brushing, while appropriately selected Veterinary Oral Health Council products may support plaque or tartar control. Hard calculus, pain, swelling, fractures, loose teeth, and disease below the gum line are veterinary problems. Finding a change does not mean you failed your dog. It means your attention worked. Choosing professional care when the problem exceeds home care is not defeat. It is responsible, loving ownership. During your dog's next 30-second check, what appears first? A new smell, a red line at the gum edge, or a change in chewing? Tell me which side you noticed it on and whether it was new or something you had been watching. I read every single comment, and your observation may help another worried owner recognize a small warning. If this video made you feel calmer and more capable, please like it and subscribe so it reaches another dog owner who may be dismissing bad breath as normal. Share the 30-second check, but remember the boundary. Notice at home, prevent safely, and treat disease with your veterinary team. I'm Dr. Ryan Scott, your neighborhood veterinarian. Stay observant, stay kind, and I'll see you in the next one.